Lower eyelid blepharoplasty is a procedure I commonly perform for bags under the eyes or dark circles under the eyes. There could be a lot of different ways to do this surgery or approaches to it, but in general, the risks are going to be pretty similar depending on how the surgeon does it. So when you go in and you work on the fat that's underneath the eye that's pooching out and causing that appearance of a bag or a dark circle, in between those pockets of fat, there is a muscle that helps you move the eye. It is rare to injure this muscle with the surgery, but it is possible. If this muscle gets injured with surgery, you could have double vision after surgery, and that is one of the risks of lower blepharoplasty surgery. It is certainly possible that double vision will be temporary and go away very quickly, but in even rarer cases, it can be permanent. Second thing with lower blepharoplasty surgery is that there might be some residual fat. It turns out the way that your fat sits when you're sitting up versus the way that your fat sits when you're lying flat on the operating room table changes how the fat sits. If you want to have a fun experiment, take a picture of bags under your eyes, and then take your phone, lie down, and take a picture of yourself lying down, and you'll pretty much see that the bags go away. That's because of gravity. That can also change how the surgeon is approaching things during surgery to try to exactly identify how much fat needs to be either removed or repositioned or put in a different place. Therefore, sometimes after surgery, there can be residual fat left over, and that's something that you can treat afterwards, but it is a risk of surgery. Alternatively, there can be a hollow appearance if too much fat is taken, and that can be a little harder to treat after surgery. If too much fat is taken out, that hollowness is something that is hard to restore, although possible. The last thing with lower blepharoplasty, and this is true, like I said, with any surgery we do, but it's particularly important to think about with lower blepharoplasty, is that if there is bleeding during surgery, or more importantly, after surgery, that bleeding can track back and cause pressure on the eye. That could result in vision loss.